Did you know that over 2.5 million people have passed away due to the malignant virus known as COVID-19? The virus occurred for unknown circumstances in Wuhan, China. The utter devastation was first reported on December 31st, 2019 as a case of pneumonia to the World Health Organization. The virus has affected many people mentally, physically, and psychologically. People that haven't had or don't have the virus are struggling due to massive shutdowns of communities. Prior to my explanation of the insinuations of COVID 19, be aware that I am credible to speak on this topic since I have done extensive research on the virus since it became apparent on the news and on the internet. COVID 19 is a worldwide issue that concerns everyone, and in this speech, I will cover what COVID 19 is, how COVID 19 affected our world, and how COVID 19 can be stopped or fought off. To begin addressing this issue, COVID 19 is a respiratory illness that has caused health systems to collapse worldwide. In adults, the virus causes severe acute respiratory syndromes. In a study of 20 patients, 16 were adults, and 13 of the adults needed mechanical ventilation, 6 needed inotropic support, and 8 of the adults developed a healthcare associated infection. Adults that are aged 65 years or older, or people that have underlying medical conditions, are more prone to the virus. Seniors may have a weakened immune system and may catch the virus more easily or be more affected by it. In children, the disease seems to be more mild, although severe multisystem inflammatory syndromes have occurred. In the same study of 20 patients, 4 were children, 2 of the 4 kids needed mechanical ventilation, and all 4 kids needed inotropic support. Children who have the virus have a mortality rate of 0.2%. There are several symptoms of COVID 19, including fevers, chills, coughs, shortness of breath, or difficulties breathing, fatigues, body aches, headaches, new losses of taste or smell, sore throats, congestion, or runny noses. Even diarrhea has been reported to occur, and it can precede respiratory symptoms or pneumonia. Many people are even asymptomatic. This graph represents the number of COVID 19 cases in the United States. Most cases have occurred during the recent fall or winter months. COVID 19 has caused much trouble across the globe. Many government lockdowns have occurred to contain the spread of the virus. Life has come to almost a complete standstill. There were many lockdowns in the US, and there were 5 main phases of reopening social gatherings and businesses. Most businesses have shut down, but they have been opened up again due to the new hope of containing the virus. Previously, many workers lost their sources of income, and as of July 31st, 2020, over 33 million people in the United States have filed for unemployment benefits. Also, many healthcare workers were evicted from their homes because they worked with ill patients. However, due to the lockdown being eased, many essential workers have returned to their normal lives. Not to mention, healthcare workers may even conduct checkups with their patients virtually. Many precautions are being used to prevent the spread of COVID 19. Many people have enforced social distancing through lockdowns. Governments say you should only leave your home for essential trips, including doctor visits and grocery shopping. Governments say you should keep at least 6 feet apart from others. Also, governments say you should limit the number of people you're around to ideally less than 10 people. Governments say you should wear a mask whenever you're in public, which protects you and the people around you. Nearly all stores won't allow you to shop without a mask. Here is a bar graph of the percentages of how many people decide to wear masks at different events in the U.S. Many people wear masks when shopping at grocery stores. Not to mention, there are several COVID 19 vaccines available to older and more vulnerable citizens, including Moderna and Pfizer. These vaccines have a 90% efficacy or effectiveness in fighting against COVID 19 in clinical trials. Washing your hands for at least 20 seconds is also important, since the cleanse will wash away any viral particles. Taking all these precautions stops the spread of the contagion for the most part. In conclusion, COVID 19 is a malignant disease that concerns every person on the planet, and this virus can be fought off through proper precautions. No one is immune to the virus, and everyone should be informed of the contagion. COVID 19 may have induced lockdowns, unemployment, hospitalizations, and mortality, but the virus can be battled through safety precautions such as social distancing, wearing a mask, washing your hands, keeping everything sanitized, and getting vaccinated. Chaos is reduced to remembering that we're all in this together, and no one is alone in these uncertain times. Thank you all so much for your time.